So, good evening, one and all. This time I'm doing a topic entirely different from what I used to do, orthodontics or early age orthodontics. This time, talking about AI and its application in dentistry. So, since this is not our dental topic, let me tell you, this is what I'm sharing is what I learned over these years, multiple articles, textbooks, and my own brother in US who is in charge of, who is the vice president at this point of time in a multinational company where he is in charge of AI. So the feedbacks from him helped me a lot. So thanks to my brother Biju, and thanks to all that supported me on preparing this. So, AI. Let me start with an opening statement for those people who think, oh, come on, that's there. What is the big deal about AI or other way around? That's not going to reach anywhere, or this is going to take away our jobs. Come on, where are we heading to? Whatever be the attitude, one thing I want to start off this lecture is with this statement. If your phone can recognize you just by looking, if your phone can recognize you, can it recognize a teeth? Can it recognize a cavity? Can it recognize the depth of the cavity? Whether it's pulp involved? Anything is possible. If your phone can look at and detect you, and you can do payments by just your phone dictating your face. So where are we at this point of time? With that, let me go forward. What is artificial intelligence? Guys, artificial intelligence has been there for years together. There is nothing new in it. It's been there for more than 50 years. 1953, the original concept of AI was coined. Original concept where that artificial intelligence was coined. 53. It came a long way forward, and it's been around with us. With you, it's there. For example, the Netflix. Netflix automatically detects the type of movies you watch, and it recommends the next movie. Haven't you seen that? That's AI. It's been there. And your Siri, your Alexa, all that has been doing the same thing. Then how come it became such a big thing? Why is it suddenly so famous? Why is AI suddenly very big? So big that people are worried that they will lose their job. Can somebody come to the chat box and tell me how come suddenly, recently, this became a big topic of discussion? Why is AI so big now? Guys, AI became so big because of just one thing called as Chat GPT. Chat GPT brought AI into everybody. You guys must be using it by now, or at the end of this lecture, at least you will start using it. And even Meta has AI. So it's there. There are multiple platforms at this point of time. And that revolutionized everything. Everybody started using it. Up till that time, it was not that popular. So Chat GPT, I would say, is the reason why we have a lecture on this now. Now, to understand the significance of Chat GPT, Let me show you a small graphical representation here. Time to reach 100 million users. LinkedIn took 7 years and 11 months to reach 100 million users, while Twitter took 5 years and 5 months. Facebook, 4 years and 6 months. YouTube, 4 years and 1 month to hit 100 million users. Snapchat, 3 years. WhatsApp, 3 years and 6 months. Instagram, 2 years and 6 months. WeChat, 1 year and 2 months, and then TikTok, 9 months. And now look at ChatGPT. Within 2 months, it reached 100 million users. And that's how now we are discussing about it. Let me go forward on basics of how AI works and what we should know as dentists. It's a very short class, okay? I'm going to finish very soon how AI works. To understand how AI works, I have to explain certain terminologies here. Supervised learning, deep learning, predictions, prompting, generative AI. These are the few terms I have to explain here. These are technical terms, I know, but I am going to explain it as simple as possible with examples, with daily examples, regular use examples, and dental examples. So you should be able to get it. Let's talk about supervised learning. What is supervised learning? Supervised learning is like you show the computer multiple pictures. For example, a picture of a bird, picture of a cat, multiple pictures of cats, and the computer recognizes it as cat. That's supervised learning. To understand that better, let me put it as an example. It's like a mother showing her daughter, like how our kids grew up, showing daughter the picture of a cat or a dog. The kid recognizes that it is a dog. How did the kid recognize? By the brain's, our neural network, our neurons. Kid recognized that it is a dog. So kid is shown multiple dogs now, and now kid is definitely able to identify that it is a dog. But in the dog, there are varieties of dogs now, but kids started understanding that it is a dog and then started slowly learning into the next level, which actually comes in deep learning. I'll cover that, where it starts recognizing multiple types of dogs. So how is that done? With our conventional, our brain, the neurons, and the network. That neurons, that passing of information, that's how a kid learn. That's how you guys learned your anatomy. Your masseter muscle, your temporomandibular joint, you learned it for the first time from Chaurasia. Then you saw it in maybe Gray's Anatomy, and then you saw in the cadaver. That's all supervised learning. Same way. And then you see multiple dogs. The kid is now able to recognize. The same thing goes with the computer. Same thing goes with artificial intelligence. It is shown multiple dog pictures, and the conventional neural network becomes the artificial neural network, ANN, in the computer with multiple codings and vectors and graphs and analysis. It recognizes. For example, coming back to the dog again, you show the picture of the dog to the computer immediately has all these vectors. The distance between eye to nose, eye to tongue, eye to chin, everything is being recognized within few seconds. And the computer is now ready to understand that it is a dog. Like how a kid understood for the first time. That is supervised learning. Now the computer or the kid, it's the same, can now differentiate between dog and cat. Because the dog, according to the computer, has a neural that networking, which is the distance between this, that identification landmark. Cat has a different landmark, and the computer starts recognizing that it's a cat now, it's not a dog. So you put a picture of a dog to ChatGPT. You can do that. You can do that live. If it was an offline class, I would have asked everybody to take your phone and put a picture of the dog into the ChatGPT or Meta AI and see what's the result. Obviously, it will say it's a dog because it is being learned or taught like that. Like a kid. You ask a kid, show a picture. Is this a dog or a cat? So this goes slowly into deeper learning. It now analyzes in depth the complete face or the whole body, completely analyzed in depth. And the computer can now, like a kid, can now decide whether it's a dog or a cat. Now, if you show a picture like this, which is like what? Not a cat, not a dog, kind of a picture, ChatGPT can go wrong because it's learning. A kid can go wrong. What is this? This is a cat or a dog. It can go wrong. So the deeper learning or the convolutional neural network, the CNN or the artificial neural network can go wrong also. So that's the deeper learning. Now related with our dental stuff. You see an X-ray. An intern see an IOPA and a specialist see an IOPA and Ron to see an IOPA, it's different, right? Now you see an IOPA, you understood there is a lesion or whatever, but you discuss that with your specialist, you get little more information. Same way, this goes deeper. This goes deeper, analyzes each picture in depth and comes to a decision that this has a periapical lesion or this is a cavity which is not pulp involved. So we are from supervised learning, computer starts automatically going in depth, relating between what it was taught in the supervised learning. So this is like getting opinion from other specialists. Now comes our face recognition. I started off with face recognition. That is one of the finest example of AI. And your Digiyatra, all that is exactly the same. You just have to show your face. Now, there are many clinics now with that scanning screen. You go stand in the reception area in front of the screen and show your teeth up and down. It starts giving you a list of what all are your problems. It's the same. It's simpler than identifying a person and letting the person get into that plane. It can be a terrorist. So identifying a teeth and finding whether there's a cavity in it is nothing compared to this stuff that is happening with Digiyatra and all that. That is part of that networking, that is part of that vector analysis, distance between each and every coordinate being analyzed in few seconds and immediately decide, yeah, this person is Dr. Joby, he can get into the plane. That is the kind of speed, efficiency we are talking about when it comes to AI. Now we have to go into another terminology that is called prediction. These are all technical terms. I'm trying to put maximum examples as possible. So supervised learning, and from supervised learning, the kid slowly started interpreting that this is not a dog, this is a cat. How the kid do the same thing computer does with graphs and vectors and numbers and all that, codings and all that. Prediction. Simple example. Mother is teaching the kid to make a dish, cooking. So the kid is learning cooking for the first time. So planning to make a dal fry. So what all are the ingredients required for dal fry? The mother tells the kid each and every ingredient one by one. Tomatoes, red chili powder, garam masala, the tur dal. Yeah, explains everything to the kid. Same way, computer is also being taught that way. Now, when the kid is told about tomatoes, red chili, tur dal, or whatever, when it comes to the computer has a percentage system. To make dal fry, it knows that more of dal is required, less of tomatoes, very less of chili powder, very less of mustard seed. So it's all graphical and vector presentation by the computer for making a dal fry. Now, suddenly, if the mother, when talking with the kid on how to make a dal fry, suddenly mother says, okay, now bring chocolate. What? The kid will be like shocked. Oh, Mama, why chocolate in dal fry? Same shock happens in the computer also, because in the deep learning and supervised learning and the deep learning, or the machine learning it's called, it has a vector. I told you the graphical thing. So the distance between each thing, dal and turmeric and mustard and coriander, distances are almost there when it comes to dal. But suddenly when chocolate comes in, the distance is far away. Chocolate do not come in that category of tur dal, the dal fry preparation. According to the computer, it is in a longer distance. It doesn't match here. Same way, your temporalis is a fan-shaped muscle. The origin and the insertion, everything is slowly getting embedded, and then suddenly the biceps come in. It has nothing to do with this. So the moment you see masseter muscle, temporalis muscle, it is like the computer starts predicting that this fellow is talking about temporomandibular joint, or this fellow is talking about the muscles of mastication. That's prediction. Same when it comes to the mother-daughter cooking. Okay, let's assume mother says the kid, bring cocoa powder, bring cheese, butter, cocoa powder, flour. The kid now slowly starts getting an idea. My mom is planning to bake a cake. Suddenly, chili powder won't fit in there. So, prediction starts coming in. The moment you put in cocoa powder, butter, computer starts predicting that looks like you are planning to make a cake. So, let me help you. That is the kind of prediction part that is happening when it comes to AI. So, AI predicts. Another one is generative AI. Am I going too much way above, or okay, manageable? Anybody coming in video, please show me a thumbs up at least to know that I'm going okay, you can understand something. I wanted to make it as simple as possible. Yeah. Okay, thank you so much. There are many people in video. Yeah, thank you so much, Dr. Rishabh. Thanks a lot. Okay, generative AI. That is, AI now starts generating stuff. For example, I told you, you put in ChatGPT cocoa powder, butter, couple of things, it will automatically generate a recipe for you to make a cake. Because that coordinates are all matching towards cake and not to chicken curry or anything. So that's the generative part of it. Now you want to make a chicken dish. It will automatically generate a new recipe for you from all the data it has. And then you can now say, I need a South Indian styled chicken dish. According to the algorithm or the vector principle, it knows that South India's spices are more compared to maybe an Italian chicken dish. So it will automatically generate a new recipe for you. That's a new recipe or original recipe. It will give a something like a new recipe for you. Is it new? Is it an original one? Copyright issues. There are many, many other things when it comes to these kind of generative AI concept. Now, simple examples. I need a birthday wish to my son. Just wrote as one line, I need a birthday wish to my son. It will give a wish. Happy birthday, my dear son. Every year you grow, not just in age, but in kindness, strength, and wisdom. You make us proud, not only with what you achieve, but with the amazing person you are becoming. Okay, that's a message. Because what did you give to the computer? I need a birthday wish to my son. You never gave any other detail. What I'm trying to cover here is something called as prompt or prompting. The better you prompt, the better results you get. And ChatGPT will ask you this particular thing. I did it live last day, and a screenshot is being put here. It asks you live, it asks you, you want me to rewrite it to make it more funny or emotional, or so it's asking you. So the more better you prompt it, the more better result you get back. That's called prompting in AI. That's so very important how you prompt. So in this particular case, I said, okay, make it more funny. And then I got a funny message. What is that? Happy birthday, my brilliant, hilarious, and occasionally annoying son. Another year older, which means you are now one step closer to paying your own bills. Until then, we'll continue to sponsor your food, Wi-Fi, and unlimited advice, which you didn't ask for. So it tried to become hilarious or funny. It can become emotional. It can give you, for your wedding anniversary, a very emotional message for your wife, but prompt properly. When it comes to our dental also, just put one X-ray and tell me what it is, ChatGPT. It might start saying, yeah, this looks like an OPG with the mandibular borders, with the condyle. We don't need that. Be prompt clearly that I would like to know the diagnosis related to the lower right molar. Prompting is another point I wanted to cover here. There's a very famous joke that happened, that is Mother Teresa. Somebody put in WhatsApp, in Chat GPT, Mother Teresa fighting against poverty. Chat GPT, please give me an image of Mother Teresa fighting against poverty. And this is what Chat GPT gave. Because it's not prompted well. Fighting, they look at these words and fighting against poverty. So when the poverty comes in its learning, supervised as well as deep learning, there is this poverty images and all that already set there. And when it comes to Mother Teresa, it is there. Fighting, it's there. That's how computer relates. So the better you prompt, you get better results out of it. That's about the prompting. Now, that is it. That's all I wanted to talk about. Supervised learning, deep learning, deeper networking, yeah, deep learning. Then all that prediction part and the generative part and the prompting, the few words I want you guys to know when it comes to AI. Now, quickly, I'll wind up with some things about dentistry. When it comes to dentistry, I think radiograph is one thing that is definitely helping you out as dentists. You have this image and then you have this image. It can definitely locate that there is a lucency there, and it knows now from deep learning what is the pulp chamber of each teeth anatomy, like how you learned each teeth anatomy. You show this to a first year BDS student. First year BDS student may not be able to identify a caries there, but a final year BDS student will be able to. An MDS will be definitely able to find out the complete it's the same thing. It's a learning process. The learning process is going on. And every X-ray, you just Google it, you will see that every X-ray has around 64,000 shades of gray. And human eye can detect only around 800 or 900 shades of gray. So within fraction of a second, AI can go through all the 64,000 shades of gray and come to an exact picture about the cavity, its depth, about its pulp involvement, about the periapical, you name it, it can. No doubt about it. And it's an evolving field. We are very early in the game. It's evolving. Yeah. And there's a beautiful article on the study on accuracy, wherein 3,000 IOPA was analyzed. 3,000 IOPA was analyzed. And AI had 75 to 93% accuracy according to the article. I'll send you all these articles. Just personal message me or in one of the groups you are in. 75 to 93% accuracy, and clinician, a dentist, accuracy is 19 to 94%. What does that mean? Our accuracy has a big variation. Again, first year BDS you give, final year BDS you give, 5 years into practice, 30 years into practice, there's a huge difference. As a matter of fact, Reader's Digest has already come out with a study about dentists, saying that you meet 50 dentists, you get 50 diagnoses. It's there in Reader's Digest. So that accuracy 19 to 94 is such a big gap. I mean, that's too much. That means you tend to be wrong many times. And the accuracy of AI is consistent. So the conclusion of that part on X-ray reading is it is definitely more accurate. High speed, no doubt about it. And I think as dentists, what we should know is our mood of a clinician. 10 cases you see IOP or OPG, and the 11th case, and then you get a message from your wife or girlfriend, you're a little irritated. Now the way you look at the X-ray is slightly different. Nothing like that happens to the computer or to AI. You give thousands of X-ray, it will immediately generate it. No mood swings and all that for AI. So definitely this will score. Just I put an X-ray, a normal chest X-ray, and then I put another X-ray with pneumonia patches in it. And look at what ChatGPT said. Just ChatGPT. See, ChatGPT, Meta AI are all free AI apps. There are so many other paid AI apps which are way, way more superior. It's like your Paint software came. No, initially in Microsoft, there's a Paint thing. The Photoshop, Adobe Photoshop is way better than Paint. Same way, there are many, many, many AI platforms now competing, one better than the other. So ChatGPT, the free version, said there is a right lower lung field showing homogeneous, well-defined opacity and suggesting pneumonia. Now, why am I showing this here is because you go to a doctor, you take an ECG, before even meeting the doctor, you can put in ChatGPT and you get a rough idea what's going on, and then you go meet the doctor. Please understand, same thing our patients are also doing. They have gone through this ChatGPT consultation, and we dentists, our biggest problem is we work in isolation. We work alone. So we have nobody to ask for. So you got to give your opinion, whether it's right or wrong, you got to give your opinion. Maybe some specialist might be there. You might say, come on so-and-so date so that I can get my specialist's opinion. Now, this one is getting the opinion by the deep learning methodology. It will give you better opinions, like you discuss with more people. Orthodontics. My God. Orthodontic diagnosis, treatment planning, AI is going into a different level, especially when it comes to clear aligners. I don't want to go in depth on that, but all I want to tell you is a beautiful article again, which is on ANN, Artificial Neural Network. for deciding if extractions are necessary for or prior to orthodontic treatment. So you have a patient, you have the upper lower picture, the facial picture put into AI, and the AI decides if extraction is needed or not. Guys, the result 80 to 93% accuracy by AI compared to, see, this is a study. It compares an orthodontist perspective and AI. And what the orthodontist who decided for bicuspid extraction, AI was with it. Or decided non-extraction, AI was almost 90% accurate in that. So we are talking about extraction, non-extraction decision made by AI. Again, why am I saying this? Patients are going to come in saying that, doctor, is there any other method other than taking out 4 teeth? You better know, because they have already gone through a complete round of analysis and they know the alternatives already. Then perio. When it comes to perio, there are many, many, many. I think perio is one of the biggest advantage in AI, I would say, is ortho, endo, and perio. When it comes to perio, see, looking at an X-ray, whether there is a bone loss, angular bone loss, everything AI can detect. But that's not what I'm trying to convey here. What I'm trying is the correlation of various parameters. For example, if there is a case with a severe gingival recession and periodontitis, and that patient's blood result, not just WBC and RBC and all that, complete blood result with leukocytes, IgG antibody titer, the interleukin, eosinophil, AI can correlate all this and predict that this OPG guy with all these values is a high risk case for a heart disease. So that's prediction part very, very clearly here, which is going to help in our practice. Because you tell patients you have periodontitis, you might get a heart attack soon, they will kill you, or they say, okay, sir, thank you so much. Now, AI is telling by correlating with multiple values makes sense to the people. So this is only going to be useful for us, not harmful. That's what I'm trying to tell you at this point of time. And then endodontics. Endodontics, the number of canals, root length, canal width. Again, compare with a kid cooking for the first time, or compare with a first year BDS guy looking at an IOPA. How many canals can a first year BDS guy identify? No. Third year, fourth year can understand more. Endodontist can definitely understand more. That's the same deep learning concept happening in AI. It can go in depth and find out the canal length, number, width, everything. So, as I said, a fresher seeing an IOPA, endodontist see an IOPA. You always correlate with that mother teaching the kid for the first time, or you started reading about masseter temporalis for the first time. How did you learn that masseter is one of the muscles of mastication? The same thing. It's a learning process that is going on. And this is another beautiful article for endodontists. Deep learning artificial system for assessment of root morphology of mandibular first molar. Root morphology of mandibular first molar on a panoramic radiograph was analyzed. Beautiful article. You should read it. And the conclusion of that is deep learning system showed high accuracy in the differential diagnosis of a single or extra root in the distal root of the mandibular first molar. Beautiful article. So all this is proving the power of AI and how it is going to help us. So I'm concluding here with how is it going to help us? I would say the impact on us mainly is on practice management at this point of time. As I told you, we are early in the game. There is a lot more to come. We are very early in the game. But researchers are going on. Deep learning has identified that there is a cavity The cavity depth has been identified. Now it is being converted into robot. So the robot can now actually even do the cavity cutting. Or everything is going on. There's the other side, the hardware component of the software is also going on. Robot taking over when it comes to crown cutting. Crown cutting can be beautifully done, better than you buy AI assisted robots, because while cutting, if it is about to touch the adjacent teeth, it knows that its adjacent teeth and should not touch it. And then suddenly the tongue comes in there. AI immediately detects that the tongue is coming, stops right there. So it is definitely better than you doing a crown cutting. So the robot part is also coming in soon. We will have more lectures on AI soon as more and more things start coming in. But at this point of time, we are a little early in the game. So presently, I would say patient acceptance is one big thing. Patient acceptance. I told you, you show a picture of a cavity with the earlier. Remember the intraoral camera we had, and we used to show the patient the pit and fissure. Who used to listen to all that? They come in when you have pain. But now AI shows that you have so and so cavities, you have so and so pit and fissure sealants to be done. They understand better. And then general awareness, like periodontal issues causes heart attack. We have been yelling, periodontists have been yelling through conferences and all that, but will patient understand that? Now patients will start understanding because ChatGPT is telling so. A kid with the ECC, you put a picture in, and then this is the kind of report you get. Significant loss of enamel and dentine. Some crowns are almost completely destroyed. Brown black discoloration indicates advanced dental caries. Please understand, parents will take the picture of their own son and put it in ChatGPT. Good, it's good for us. Let them do it so that when you say something, it will have more value. You can actually tell them, see, why don't you just, I'll give you a picture of your son. Why don't you put that in the chat GPT and check out for yourself? It will give all the details. And the best part about chat GPT, it even says these kind of precautionary things also. Isn't that amazing? The counseling part, stop bottle at night, reduce sugar. You tell 100 times, they won't listen. But now when chat GPT tells, they might listen. So it is even giving parental instructions also, which you are supposed to give, which they never listen to. That is what's happening. And these pits and fissures and all. Who cares for that? No pain, nothing. That's why I didn't come. Kind of an attitude is still happening in dentistry in India, at least. No concept called as every 6 month routine checkup and all that. So if this the many clinics in Kerala, especially as I know, has come out with the scanning thing. You go in the reception area, show your teeth, gives a list of things to be done, and even the rate, I think. But at least they are more aware now. And this picture, look at the amount of things chat GPT is telling. I just did this recently. Just put a picture, random picture from net. Dark brown lines in the central groove of the middle tooth indicate enamel demineralization, like early stage caries. Now you tell them this might become a cavity. It's better you do a pit and fissure seal, and they won't listen to you. But when this guy, the chat GPT or the AI says, they give more value. The calculus, the typical issues which you face. Don't do scaling on day one. Let them go do research on about it. Put it in chat GPT. It will tell you exactly what all is happening there and the need for. Otherwise, what all patients say, you took away all my enamel. I had preserved it there. You took away all my enamel. Now look at it, what gaps you have made on my teeth. All that will now go off. Let them research. Please don't do work on day one. Let them do second opinion, third opinion. Now the second opinion, all chat GPT opinion. Third opinion, maybe another dentist. Let it happen. Lastly, instrument separation. Before, when there's instrument separation, you're so hesitant to tell the should I tell? What if I tell? What if I don't tell? Guys, if you give the X-ray out to them, They just have to put it in one of these free AI platforms and look at what AI says about instrument separation. So you better tell them that there is a separation. Retained instrument can prevent complete dissection of the canal possibly leading to persistent infection, treatment failure, or need for retreatment and surgery. What are the management options? Attempt to retrieve the broken file using ultrasonic tips or specialized retrieval kits. Bypass the instrument and fill the remaining canal if retrieval isn't feasible. These are the things you're doing every day. Huh? But now that is being documented and that is being approved by AI. Otherwise, if you don't mention all this, you will be in trouble. So be open, let everybody know because they will find out one day about it. That's it. Let me summarize. All I wanted to cover was about the supervised learning, the deep learning part, the prediction possibilities, the prompting, how well you prompt and how well you get a reply. The generative AI part, it generates you a whole movie script if you want. It generates you a complete treatment plan if you want. You just ask, I have a TMJ clicking, it will give you a treatment plan. So that's the generative part of it. That's all I wanted to convey here. Thank you so much. AI will not replace dentists, but dentists who use AI may replace those who do not use AI. You got to use it. Be it from daily medical certificate giving, letter giving, birthday wish to your wife, you better use it. Because if you do not use it, you will be replaced by people who use it. Thank you so much. That's all I wanted to convey. Very pure basics of AI and its present implications in dentistry. I didn't want to go real in depth. As I told you, we are very early in the game. Thank you all.